Hey guys, this is Chad Poor again with you from Butler County EMS here in El Dorado, Kansas. A lot of you know that we shared our video last week of our new ambulance that's behind us that we kind of built and designed for safety with that. We got a lot of feedback from that. We've had a lot of views from it, over 45, almost 50,000 views of the video. We've had over 135,000 people that have saw it, and most of those is clicked and views, or a lot of them have clicked and views. So we're pretty excited about that, but the biggest piece of it is we recognize there were a lot of questions from the videos. We had a lot of people reach out to us with various questions about the design, about some of the things that we carry or don't carry. One of the big ones that we got, first of all, was our first in bag. If you guys remember at the beginning of the video last week, I talked a little bit about our first in bag, and a little over 3 years ago when I got to Butler County, we had a first in bag that weighed over 40 pounds. So crews most of the time on all their calls, they would show up, they would grab that first in bag, grab their monitor, and they would go inside on the call. So you can imagine the wear and tear that crew members picking up a 40-pound bag all the time throughout the day, eventually over time creates on their body. So there's a lot of rotation, a lot of twisting, a lot of grabbing, a lot of pushing, a lot of pulling. And so there's a big chance for back injuries with that. And we, like most other agencies, have had some sort of back injuries. Those are things that we want to make sure that we can cut down on. We look a lot at lifting and moving. We talk a lot about how we lift patients. You guys saw our power load system that we have here. Everybody focuses on cots and those kind of things, but some of the things we fail to remember to think about are some of the simple, everyday things that our crews do, such as grabbing a bag to go inside. So we recognized that they had to grab this 40-pound bag a lot. That's what they did most of the time, and we wanted to figure out a way to cut down on the wear and tear for them. So we put together a group, we started looking at what we carry, we started evaluating processes, and we came up with a bag that we were able to put on our trucks to be our first in bag. It weighs just under 10 pounds. Our goal is a bag that weighs under 10 pounds all the time. If crews want to add something to it, we can do that as long as the bag stays under 10 pounds. So this bag stays under 10 pounds. We were able to go out and find a StatPack Medslinger bag. Works out perfect for our crews to be able to use. So we're going to show that with you today. Talk to you a little about some of the things we carry inside of that bag. So if you come over here, I've got Alan Turner, one of our paramedics with us, who's going to help us demonstrate the things we have in the bag. So Alan's going to go ahead and grab the bag. So obviously you guys can see that we store the bag right here up front for easy access. The other thing that's stored with this bag is our Zoll monitor, because those are the two things we take in on pretty much every call we go in on. So Alan's got our StatPack Medslinger bag right here. It's pretty easy because he can throw it over his shoulder pretty comfortably. He can carry it by the handle right there. And since it's less than 10 pounds, he doesn't have the wear and tear on his body as what they did with our 40-pound bag. So that's one huge benefit with it, is it's lightweight. We can still store a lot of stuff. So Alan, let me ask you a question here. So if you show up to my house and you need to assess and evaluate me, you've obviously got your monitor for heart stuff, things like that, any cardiac, but what things do you carry in this bag that you can use to help perform your assessment on me to figure out what's going on?
All right, so on our first pocket here, we've got a stethoscope, blood pressure cuff, glucometer, finger probe, pulse ox. That's all right here in the front.
Do you have a way, to check, if I'm unresponsive or anything like that? Do you have a pin light in this bag, or do you guys carry that somewhere else?
We've got in the front pocket here trauma shears, safety goggles, a pin light, all that right here in the front.
So you have the capability of protecting yourself with the safety goggles. You've got your trauma shears, should you need to cut anything out with that, but you've got all your basic handheld assessment tools that you might need to be able to evaluate me.
Absolutely.
So let's say that you start evaluating me, you notice I start complaining of chest pain. You've got your monitor with you. We've got oxygen on the cot with non-rebreathers and stuff. So I'm having chest pain and you need to kind of start treating some of that. How are you going to do that with this bag?
So in our back pocket here, we've got a pocket full of just basic medications, things like for chest pain, such as aspirin, nitro, an IV kit there to start any IVs that we need to do for any IV meds.
Okay, so you've got the aspirin, you've got the nitro. You can give those to me. You can start your IV on me. The monitor is going to let you do your 12 lead and all of that. You mentioned the IV stuff, so you can start an IV. So if let's say I'm a diabetic, you've got a glucometer, you already said.
Yep.
Diabetic, what are the things that you have that you can take care of with me on that?
So in this pocket here, we got oral glucose. We've also got our IV dextrose here.
Okay, so you're able to take care of me if you show up and I'm diabetic, low blood sugar. You can figure it out. You can start the IV, or you can give me the oral glucose and the dextrose. What if I overdose? What if I'm a narcotic overdose?
So in that same pocket here, we've got 2 milligrams of Narcan. Check your pupils with your pen light there.
So basically, so far we've talked about you've got your primary assessment tools, a lot of those things. You've got the ability to start an IV on me. You've got the ability to give me some basic medications if I'm having chest pain. If I'm diabetic, you can do that. If I'm an overdose, what other kind of things do you carry in here as far as medications or treatments or situations can you take care of out of this bag?
So for like a hypotensive patient, we've got IV fluids here. We've also got things such as Benadryl for allergic reactions, Zofran for any nausea, vomiting.
Do you have, with the nausea and vomiting, you've got the Zofran, do you have anything else for nausea and vomiting?
Yeah, we have in the front here a convenience bag that's right here in the front, easy to get to quickly if you need it.
Okay. So the Benadryl, the Zofran, what other situations can you take care of?
We've got our 1 to 1,000 epinephrine here for allergic reactions. We also have Solumedrol in here, a steroid that you can give IV for difficulty breathing, things like that.
Okay. So so we've covered kind of a little bit of the assessment, a lot of the medical patients. Obviously, we don't have any type of narcotics in here. We don't have any type of anti-seizure medications, benzodiazepines, things like that, controlled substances. But otherwise, on the medical side, we can cover a whole lot of stuff here. What about on the trauma side? What can you guys do for us on trauma side?
So in our front pocket here, we've got things like triangle bandages for broken arms, collarbones, things like that. Large roller gauze in there. The trauma shears in the front. Small roller gauze. Some basic 4x4 dressings, 5x9s. Our cat tourniquet. Petroleum dressings, and our needle decompression.
You guys have a trauma dressing or anything like that?
Just these dressings here and an ice pack.
Okay. So no big trauma dressing in it right now. Room in there if we needed it. But pretty much you can basically handle most medical stuff first in with that. Most trauma stuff first in with it. You can do a lot of your assessment stuff with it. So what percentage of calls do you think that between this bag and your monitor are you able to take care of without having to grab additional equipment out of the ambulance?
Probably easily 85 to 90% of our calls.
So about 85 to 95% of the calls we're able to handle by just bringing in this first in bag along with our cardiac monitor. So we're bringing in a bag that weighs less than 10 pounds and it covers us on the majority of our calls. Now, some people will ask, well, what about those situations you can't cover? Well, we still have an airway bag that has an extra oxygen bottle, carries our CPAP stuff with it. We also have what we call our critical care bag, and that's the bag that's going to come in anytime that we have a cardiac arrest that we know of, probably a lot of our unresponsive patients. Any of those calls that the information we're getting sounds like this could be a critical call and we may need some of that critical care stuff. We have that in a totally separate bag that carries medications, our IO, that carries things like our bag valve mask, our intubation equipment, all of those things. And so, yes, there are times where our crews have to bring in more bags. There are times where they may actually have to bring in the monitor, the first in bag, and 2 other bags. But what we've realized over the last few years, is that we're actually saving a lot of wear and tear on them by allowing them to use this first in bag on 85 to 95% of their calls. And the few times that they do have to carry more bags, we're still saving wear and tear on their bodies. So our crews love it. It's quick and easy for them. They can restock it quick and easy. It provides them most of the tools that they need to manage the majority of our calls. And more importantly, it's a better safety mechanism for them. Saves wear and tear on their back, on their shoulders. And so we don't have to worry about as many work-related injuries from that piece of it. So once again, you guys can see it's a Medslinger bag from StatPack, weighs less than 10. We fill it with stuff that's less than 10 pounds. You could fill it with anything you need. We have some extra room in it. We switch it back and forth at times. There's times where we'll add things to it and take things out, but it is something that you could look at in your agency, something you could stock to your needs. But again, it's something that you keep the weight low on so that you're not creating that wear and tear on your crew members. So I want to say thanks to Alan today for coming out, talking to us about the bag a little bit. Thanks to our cameraman Mike for filming it. We'll be back in the next few days to talk about some of the other frequently asked questions that we got from our ambulance tour video, so that we can make sure and answer all the questions that you guys have. Feel free to reach out to us on our Facebook page if you want. You guys can hit us up there. We also will upload this video onto our YouTube page, which you guys can look at under Butler County EMS, and we'll answer any questions that you guys may have about anything that we're doing. Our biggest goal is to try and continue to push for safety, a safer environment for our crew members and our patients and the general public at large. So thanks for watching us again, and we hope to see you guys soon.